Hi, my name is Reem Boudali and I'm a fourth year peer mentor in the general lab, and today we're going to discuss peripheral IV insertion. So our fourth years have the option of taking our PIV course, which will certify you to insert peripheral IVs in a clinical setting. In order to do so, you first must review all the material posted on Brightspace, so this includes all the modules, the videos, and any reading content that was included. Once you feel confident in that reviewed material, you can book a peer mentor appointment for your virtual quiz. During this quiz, the peer mentors will ask you questions based off of that content to ensure that you have reviewed that material and understand it. Upon successful completion of the quiz, you can then book an in-person appointment to practice the hands-on aspect of the components, which is what I'm going to review today for those of you who haven't had the experience of inserting an IV before. We're first going to discuss a little bit about the basics and the fundamentals, about the anatomy and why we're doing the steps that we're doing, and then we're going to jump into the steps. So with your IV, you have multiple things to worry about. So you have your catheter that you're actually going to insert. This has a needle portion to it, and then it's covered with a plastic sheath that's actually going to stay in the patient. So the needle is just used to poke the patient and to guide that plastic catheter in. After that's complete, we'll click a button to shoot back the needle, and it doesn't stay in the patient. We have our tegaderm that's going to cover it. We'll also need a connector piece to help extend it, a sterile cap, a flush, gloves, alcohol pad, and a tourniquet. So it's important to note that you're going to be inserting this into a vein, and our needle has a bevel to it. So as you may know from the material, how you're going to start off with your insertion is you're going to go at a slight angle. You want to try and keep it as flat and straight as possible. So maybe a 15, 20, 30 degree angle at most. You're going to insert, and because we have that bevel, what's going to happen is that needle is going to break the skin. And when it breaks the skin, what's going to happen is that since that blood is flowing in the vein, it's going to come up the needle into the part of the catheter that's going to do what we call like flashback. So you might hear some people say like you're looking for that flash of blood or that flash of red. That's what we're looking for. Once you get there, however, you still want to insert the needle slightly more, because as soon as you poke the skin, so as you can see in this diagram, you're going to get that flashback, but that doesn't mean that the needle is fully in the vein yet. So if we were to push our plastic covering right now, we're just essentially pushing it along the wall of the vein, and we could potentially burst the vein and not even get it in the vein to end with. So you want to push the needle in slightly so that it'll sit right at the top, or ideally in the middle. And then what we're going to do is we're not going to push the needle any further, because if we push it any further, it's going to go straight through the wall of the back of the vein. So we want to just make sure it sits here. So what we're going to do, and I'll show you this afterwards, is we're going to maintain our position and hold the needle still, but only push the plastic catheter in. That way, only the plastic catheter sits in the vein. Now the reason why we want to make sure that the angle is so flat is because the deeper of an angle that we insert the needle at, the more tension there will be on the vein when that plastic catheter comes out. But if it's flat, it's following the direction of the vein, and there won't be as much tension, there won't be as much pulling if the patient moves, and we don't risk bursting the vein as much. So we have all of our equipment laid out. First thing that I'm going to do is I'm going to prep my material so that when I am doing my actions, I don't have to waste any time. So first I'm going to do my hand hygiene. And put on my gloves. And I'm going to open all my packaging. So I open up my tegaderm, and I'm going to peel off the back, and I'm going to leave the sticky side facing up so that it doesn't get caught anything. I'm going to open up my catheter, and I'm going to be using an 18 gauge. I'm also going to lay that flat. And then I have my sterile cap, or my needleless connector. I'm going to open this up and prime it. So I'm going to remove any air that's in it, and then place it back in the package. I'm going to face it the other way. My lure lock side. I take my flush, remove the air bubble from it, connect it. And then because the packaging is clear, I'm going to push until I see water come out the end, and then I know I've primed it completely. Then I'm going to lay it flat, still in the packaging so it remains sterile, and then I'm going to palpate my patient's veins. So to place on a tourniquet, you want to place it underneath the insertion site, above it about 10 to 15 centimeters. So first what you're going to do is you're going to pull laterally, because what will happen is if you try it and tie it afterwards and then you need to make it tighter, if you just pull from the top here, it's not going to tighten the bottom. So first you want to pull laterally so that the bottom part is tight. And then you're going to pull it up, and what we're going to do is we're going to almost tie a knot, but you're not going to slip the end through. So I'm going to cross the ends, and then I'm going to slip the middle part of the tourniquet underneath that crossover. But as you can see, the end remains through. It's very similar if you've ever done a wrist restraint. This way, when we pull on the tourniquet afterwards, we can do it in one fluid motion. Now, not all patients will need a tourniquet. If patients have really good veins, they may not need one. But it is great to place on a tourniquet because what will happen is it'll stop the blood from flowing backwards. So we keep the blood in this section right here. And because the blood is staying in that section, the veins are going to dilate, and they're going to fill up, and they're going to be easier to insert our catheters on. One important thing to note though is before we flush, or if we give anything in a area of the limb that has a tourniquet on it, we want to remove the tourniquet first, because what we're doing when we're closing off that section is we're building up the pressure. So if we go and we add more fluid, more volume, we're increasing the pressure, and then what we can do is cause the vein to burst. So always remove the tourniquet before flushing or adding anything into the system. So I'm applying my tourniquet, and I'm going to give it a couple seconds for the veins to engorge. Obviously on the mannequin that's not going to happen because there isn't pressure from a circulatory system. But what you'll do, and you can practice this on yourself or on a friend, is you want to palpate, and based off of the information that you read, you should know where the approximate locations of the veins are. So I might palpate in the AC, I might palpate on the forearm, and you should be able to feel a light bounciness. So if you feel on yourself with the tourniquet on, feel over a spot where you can see a vein, and then feel compared to your skin how it'll feel. And you can even feel what it'll feel like on a valve, which will be a little bounce, but it should be firm and spongy. You don't want to press because it isn't an artery, so you will occlude your vein by pressing too hard. You're just lightly tapping, and you should feel that bounce back of where that vein is. On locations like the hands, sometimes as we age, we get rolling veins in those locations because the tissue is just so loose. So what you might want to ask the patient to do is to just make a small fist with their hand so that that position helps firm up that tissue and helps us visualize the veins better. In those sort of areas as well, we might ask the patient, to reposition so that we are able to visualize better. Some other tips and tricks might be to ask the patient to pump their hand. What that'll do is that'll force the blood flow so that we can better visualize the veins. And we might apply heat. So some people will fill up a water bottle or a glove with hot water and place it on the location. You want to make sure that it's not too hot that you're going to burn the patient, but that'll help vasodilate for us to visualize or palpate the veins better. Once I have the location of the vein that I'm going to be inserting on, right there, I want to make sure that I clean off the area. When you're starting off and you don't know where the vein is and you're worried that you're going to look away, there's a couple of tricks that you can do. One is to take the cap of your needle and just make an indent and then swab it over. Some people will take their alcohol pad and place the tip of it where their location was so that they know where they're inserting. And some people will just kind of eye it off. What's important though is if you're going to make a mark, you want to do that before you clean it off, because whatever you're using to mark it off isn't going to be clean or sterile. And because we're going to be poking through the skin, there's that potential for infection. While we're palpating, we also want to determine the direction of the vein, because not all veins will run straight. Some of them will run diagonal and in different directions. And as we're inserting or threading, we want to know if we have to do that at an angle. So I know for this one, I'm going to go straight. So I'm going to swab it off and allow it to dry. Then I'm going to remove the cap off of my needle. So this is what I meant when we have the needle, and then on top we have this plastic cover with our actual catheter that's going to insert into the patient. I want to make sure that these wings that are on the catheter are flat, so there should be a little cap at the top that'll be for my finger to push it in, and that white button right there is the safety button, so we want to be very careful not to press it. So I'm going to hold this just like this, and then what I'm going to do is I'm going to insert, push gently, and then I'm going to just push with my index finger. So I'll demonstrate that, and I'll kind of tilt this over so you can see better. So I'm going to go at my angle and insert. On these mannequins, you might not get a flash of blood. As long as you know the technique, that's all that matters. On a patient, usually you'll see that flash of blood. So once I'm in, I inserted slightly, and then what I'm gonna do is I'm gonna drop my angle. And what this is gonna do is it's gonna make it as flat as possible so that when I insert, it goes along with the vein and doesn't go through. So once I'm flat against the patient's arm, I'm keeping my hand that's holding the needle and the whole contraption still, but using my index, I'm pushing that plastic catheter all the way to the skin. And once that's flat against the skin, what I'm going to do is I'm going to click on my safety. And then I'm going to connect my tubing. So I've connected my cap. I'm going to place my Tegaderm. Remember, I'm not flushing because my tourniquet is still applied. I'm going to remove my tourniquet, and then I'm going to flush. And remember, when we're flushing, because that plastic catheter is only a couple centimeters long, I want to go slightly above it. And as I'm flushing, I want to make sure that I can feel for that flow in the vein. If I'm having resistance or I don't feel that, I'm potentially not in the right area, but we'll assume I am, and then I can disconnect, and then that IV is good for use. You still want to document when you inserted it, if there was any difficulties, how many attempts it took you to insert, all of that. But that is essentially a rundown on how you would insert a peripheral IV.